Wisconsin Eye is in Waukesha. We're interviewing Mikael Langner. He's one of 3 candidates in the June 23rd Republican primary in the 33rd Senate District. Mr. Langner, thanks for talking to Wisconsin Eye. This is the first time we've interviewed you, so give us the short version of your bio, please. I always do that when I interview people for the first time.
So I've been here in Wisconsin for 2 years. I came from California before this. I went to medical school in New York, and I did an internship in Pennsylvania. So I've been throughout the country in the last 5-10 years. And for the last 2, I've been here in Wisconsin doing home calls. And I'm also a member of the Wisconsin Medical Society, and they're important to my campaign as well. So that's the short.
Is this your first run for office?
And it is my first.
What was the appeal of running for the state office and not any local, city or county? But you're aiming pretty high here.
Yeah, well, I think part of it is that there's not any positions in the legislature. So we don't have any representation right now in the legislature. And so that was one of the draws. And number 2 is that it's an open seat. So without an incumbent, my odds are a little bit better than they would have been without an incumbent. Third, I have always been interested in politics from teenage years, and so this is my chance to go for it now that I'm a physician, and I wanted to go for it, and so that's the appeal for me. Those 3 reasons: no physicians in the legislature, it's an open seat, and lifetime interest.
I always have another question for people I'm interviewing for the first time. Why are you a Republican?
Yeah, well, I'm a Republican because I believe in conservative values, so I've always been brought up to believe that life is important, and so the sanctity of life is important to me. The other thing is, as a fiscal conservative, I don't have a place in a tax and spend liberal party, and so really as a Republican who cares about people, I describe myself as a moderate Republican, not that Republicans to the right of me don't care about people, but one of the things I've heard on my campaign is, child care is important, and I don't think you're going to find a lot of Republicans talking about child care. And so health care is important, and given that this is the third rail of politics now, I think that I bring something special to the campaign that the other 2 candidates don't, and that's, I think, what defines my campaign. I'm a moderate Republican, willing to stand in the middle on some of these issues and try to bring people together to solve some of these problems.
Let me ask you about both those issues. Do you think we need broader child care that should be subsidized by state government, or why is child care one of your things?
So it's important to the economy in general so that single mothers or parents with children can get out there and work instead of having to stay home. So, you start from there. If you're at home taking care of children, you can't be out in the workforce. And one of the barriers to child care is expense. So if you're not able to afford the expense, then you can't be out there in the workforce because you're at home essentially functioning as a babysitter. And so whether it's subsidies or just simply less expensive child care, I think somehow the means has to be there. I would be in favor of less expensive child care rather than a subsidized system. But if there isn't a way to provide child care, to run a business to provide child care at low enough rates to allow people to afford that care, then I think maybe 10% subsidies, you would start there, and then if kind of a bidding process, if people are able to run a business with a 10% subsidy and enough people sign up for that care because they feel it's quality care, then I think that works for everyone. And if not, then you look for other ways to do it. 20% subsidy, and if you can get enough Republicans to vote for it and Democrats to vote for it, then you go from there. But I think you might lose some of the quality in healthcare if you start lowering your standards in terms of what you're going to pay for a child care business. So Democrats may not vote for it if the quality is not there. Republicans might not vote for it if the cost bar isn't there. So I think that's a challenge that I would try to work with both sides, maybe try to find some money somewhere else in the budget, and cut that program to provide it for child care. So that would be my approach rather than a subsidy, and then just in general trying to keep the cost bar low.
Well, we're in the middle of debating, as you know, the next state budget, and an issue that is always raised by Democrats is the question of whether Wisconsin should expand its Medicaid to take the federal money, set up our own exchange. Your position on that?
So currently, the federal policy is that Medicaid will cover up to 100% of the federal poverty line for childless adults, and then for adults with children, it goes up to 400%, depending on which state you're in. Here in Wisconsin, I believe the governor has come up with somewhat of a unique plan where he's covering up to 133% for childless adults, and even more for women with children. So I think that's a step in the right direction.
Okay.
I do think that access, through the Medicaid program for people who don't have a job that's providing their health insurance is really the only access currently that they have, or the emergency room. And so I do think that Medicaid is important, and how much the state should kick in and how much the federal government should kick in continues to be a point of contention, because these are very expensive programs. One of the things I think we need to look at is that about half of all the Medicaid costs come from about 10% of the population. And so what I do as a physician, which is preventive medicine, and some of the understanding that's come out of my practice in preventive medicine, I think can help address some of the disparity between 10% of the people taking up 50% of the cost. So, obesity, for example, which is a harbinger of diabetes, sometimes can be prevented if you address some of the psychiatric issues surrounding obesity. And so, for example, Tony Otters, who is the medical director for Anthem Medicaid Blue Shield, was just speaking with me about this yesterday at the Waukesha County Business meeting. And he was saying, we really need to address some of the psychiatric issues that surround obesity if we're going to stem this epidemic of diabetes, which is where that 50% of costs come from, the 10% of the population. And so I think I bring that to the campaign, a very clear clinical judgment and clinical competence and knowledge about these issues. And I think without any physicians in the legislature talking about this at the budget level, you really are missing a key component of what it would take to maybe address some of these issues.
Well, Democrats, as you know, say, let's expand Medicaid because it's worth an additional potential $350 million in the next 2-year state budget. The governor has said no. Are you comfortable with the governor's position then, Doctor?
Well, I think, Governor Walker is doing what he can to try and make sure that Medicaid coverage is as wide as it possibly can, given the constraints of the political climate. Now, the political climate is such that Obamacare and the Affordable Care Act have, in some ways, clouded this entire debate, because a lot of people are upset about having to pay $1,000 a month to get health insurance, and they don't want to have to pay somebody else's medical bill, which I think is the perception many times about Medicaid, that, $300 million from the state to support this program, where is that money going to come from? Well, it's going to come from my taxes, raising my taxes. And so the political climate is, as proposed by Governor Walker, low taxes. And if you're going to have that political climate, then putting $300 million into Medicaid becomes a catch-22. I mean, I think we all can agree that everyone should have at least basic medical insurance. If you look at surveys, 70% of Americans say yes, everyone should have access to medical insurance, but that same survey says that we don't want to pay for it. And so that's really what you're asking me, is how do we pay for the $300 million that it would take to cover this population of Medicaid patients? And I think part of it is maybe raising this federal poverty percentage rate. If the federal government says, well, hey, we'll cover 500%, of the poverty rate, which is currently $10,000, $12,000. If you raise that up to say $40,000, $50,000, we'll give a subsidy, just like we are with the exchanges. I mean, if you're making $40,000 or $50,000, you're going to get a subsidy. But again, it's the same catch-22, because then if you're giving a subsidy, that's essentially free money coming from the federal government, but it's probably not going to hit a Wisconsinite's checkbook as hard as it would a state subsidy for the Medicaid, which is a state program as run by the states.
Yes, it is. There was a pretty emotional health care issue just on the floor of the state Senate yesterday. The bill that the Senate passed that would ban abortions after 20 weeks of pregnancy. How would you have voted on that, sir?
I am in agreement that abortions should not be allowed after 20 weeks. Now, this is a contentious issue. The Wisconsin Medical Society, of which I am a part, and I diverge from them on this opinion, is that doctors and the patients should make this decision together. It should not be a decision from the legislature. Now, I have discussed this issue with several people during this grassroots campaign of mine. One of the things that keeps coming up is if you are pregnant and you don't know about it by 20 weeks because you weren't aware that you were pregnant or that you didn't go and have a pregnancy test, well, whose fault is it? Is it the taxpayer's fault? Is it, whose fault? Is it the baby's fault? And I think really ultimately we have to put the responsibility of whose fault it is on the parents of that developing child. And so I would have voted for the abortion ban after late-term abortions after 20 weeks because I think most people know that they're pregnant by at least week 16. And at that point, you can go to the dollar store, get a pregnancy test for $1, know whether or not you're pregnant, sit down and have a discussion with the father. Do we want to carry this baby to term? And if you're not willing to have that discussion, then we have one of two problems. Either we need to educate people that this is an important discussion to have because we can't just be treating abortions as birth control, or we need to better understand how it is we can educate people from a young age that we should not just be going into pregnancy haphazardly without some expectation about what happens if we do become pregnant.
Okay. Some other major issues that have yet to be resolved in the budget. One of them, of course, is funding for the Bucks Arena. The Bucks, a $500 million new arena for the Bucks with public help in both state and local of half that, $250 million. From what you know about the plan, is that something you could support, sir?
So I think that's a tough question. The short answer is no. I could not support that. The long answer is that, again, we have an economy here that depends on an entertainment value for the southeast region of Wisconsin. And with an aging workforce, I think bringing young workers into the area is very important. And that's one of the issues that brings people to an area is there a sports franchise? And so when I look at this issue, I read polls. So the Marquette University poll says that statewide, 8% of people agree with the plan. Around this area, it's higher. A third of the people agree with it. But in general, I don't think many people agree with it. I don't know a lot about either of the owners, but as I understand it, one of them is a contributor to Hillary's campaign, and another one has been involved in foreclosures in the Milwaukee area. So I don't think we should just be providing the two owners of the Bucks with a cash cow, which is a new arena that they'll then lease out to restaurants and make a lot of money from and leave the Wisconsinites with a bill. My understanding of the financing is that at least $50 million will be given from the state, and it will be spread over a period of approximately 20 years in terms of the payback. And the rationale is that the income that comes from the players, the so-called jock tax, will cover this $50 million. And so that's how it's being touted. I don't think that it's a good idea if you look at it from a health and all policies perspective, which is probably what I bring to the legislature that the other two candidates don't. Mm-hmm. And so you asked me earlier about, what about the $300 million from the state for Medicaid, and here we have either $50 million or $250 million from the state for a Bucks arena that will benefit the Bucks fans and the two owners and leave the rest of the state with the tax bill. I think my answer would be, well, first of all, let's take care of Medicaid. Let's do a health and all policies approach where you first of all make sure everyone has basic access to health care before you start talking about expensive restaurants and a cash cow for a couple of owners that aren't from the state.
Another unresolved issue is, of course, transportation funding. The governor is unwilling to raise the $75 you and I pay to register our vehicles or the gas tax. He would rather bond. Your position on that argument?
Yeah, I mean, I look at this from a comparative point of view. So Wisconsin currently is something like 46 or 47 out of 50 in terms of the overall road quality, and I notice this as a physician myself. The roads are just bumpy all over the place, and so I think we need to do something about the roads. I think it's a priority issue, and I don't think we should be extending long-term debt to pay for these. I think we need to find a way to do it in the current budget.
Could you vote to raise the gas tax or the registration fee?
I don't think that's a bad idea, having the people who use the roads pay for them. I think I would probably be willing to vote for at least some tax increase, but I think the gas tax is probably the wrong place to do it. I think people who own 2-3 vehicles and would therefore pay more since they're using the roads more, of those two choices you've given me, that's the one I would take, the vehicle registration.
In February, the governor recommended, as you know, a 2-year cut in state aid to the UW system of $300 million. Now that's been dialed back to $250 million. Could you support the cut of $250 million over 2 years?
So that's, I think, tied into the economic picture. So I think, you have your UW system, then you have your technical colleges, and then you have the K through 12 system. And the UW system of the three is a $10 billion system. So, I mean, if you look at that cut in terms of the whole system, it's a pretty small part of their entire budget. Could I support it? I could support parts of it. And so that's where I would say yes, the $200 million, if you're going to try and cut out some of the fraud or some of the waste or try and combine programs or have some shared administration costs, that kind of thing I would support. Trying to put some of the teachers back to work rather than doing research all the time. This is one of the other arguments I've heard put forward. I think is a good idea. I think if I was to say anything about the overall system, it would be I think we should put more money into the technical college system, which of the three gets the least funding, something like 200 or 300 million, with K through 12 getting about $1 billion. And I think in terms of the jobs gap, which is basically a skills gap, if you were to put more money into the technical college system, I think, in a year or two, you can get more people back to work. And so that's what I would do with the educational investment.
Have you taken a position on the debate and over whether to repeal the prevailing wage laws? Yeah,
so again, I think this is the overall economic picture is that people want a job. And so I would repeal prevailing wage, because I think if you give people $10 an hour, they'll work. And if you say, well, there's no job because we can't win the bid with a $15 an hour base wage, then I think people, for the most part, will say, look, I'll work for $10 an hour. If there's no jobs because we can't win the bid for $15 an hour, which is the prevailing wage, then I'm not happy either, because then there's no jobs. So I think you have to find a middle ground. Like I say, I'm running as a moderate, and that would be a middle ground. You try and get people jobs, and you get that job by winning the bid to do some of these government contracts. And so yeah, I think, and that's what the popular opinion is too. I mean, if you follow this 2-3 months ago, people were up in arms about repealing this, but in my campaign, for example, I've hired campaign signatures, and you'd be surprised how many childless adults are out there without work and just willing to go out and bang door to door to get signatures. And so those are the kinds of people who would be doing these, government contract jobs, childless adults for the most part. And I know that there are many out there calling me every week, I need a job, Dr. Langner, can I come and work for you on your campaign? And like I say, I've got 2 college students working for me right now, but I had a handful of people who just needed a job for a couple of days. And so I think repealing prevailing wage is the way to get some jobs back in the state.
There's a controversy, another controversy in the Capitol over the Wisconsin Economic Development Corporation. They have been giving loans, some of them not secured, to businesses. Do you think it's wise to continue giving individual businesses loans?
Yeah, I think the Wisconsin Economic Development Corporation issue is an interesting one. As I understand it, this is an institution that has been around for a few years now. It was
created in
originally
2011.
Headed up by the governor, who I think has now recused himself of
He's
leading
asking
it.
to no longer be the chairman of leading.
So, I don't know a whole lot about it. I think the issue of giving loans to individual businesses is reasonable. Obviously, small businesses have capital problems, and so as an independent physician working on starting up my own business, I would be one of the people applying for one of these loans. I think it's a good idea. Obviously, you would want to make sure creditworthiness is there, fiscal prudence is there, just like any other economic enterprise. If you're not fiscally prudent, then loaning money is a bad idea, and so you would need to get a statement of accountancy from each of these organizations, and that would need to be carefully reviewed. And of course, even that's something that's going on in the legislature right now, right? We're talking about having auditing being done by this new nonpartisan board. And,
right.
Yeah, so I think that's an ongoing issue. I mean, loaning money has always been done from the beginning of time. I mean, accountancy has been around for about 500 years, and so it's about trying to figure out what is fiscally prudent. So as long as a small business can say, hey, here's my spreadsheet, here's the bottom line, here's what I would do with the loan, here's how I would pay it back. You know, I mean, that's how I went to medical school. I mean, I'm paying back my loans as we speak, and I wouldn't be a physician today with $250,000 of debt if I hadn't been able to show, hey, I'm going to go out and I'm going to work and I'm going to pay it back. And you know, that's how most medical students go to school, and you know, students nowadays are taking out loans more so than ever before, and that's how we drive our workforce, with an educated workforce. And so whether you're a small business or a student or a homeowner, if you can show this is the bottom line, I need this much to, you know, you can't have frivolousness, you can't be loaning money for, you know, speedboats or whatever else, but you do need to be able to show, hey, this is the bottom line, this is how much I need, and I'll be able to pay it back.
Just a couple more questions. One of them is, we've been talking about some state budget issues. I want to give you a chance. Is there any other major issue that's a big part of your campaign that I haven't asked about that you might want to talk about now?
Yeah, I think we've talked about jobs a fair amount, and that's one of the issues that I've talked about on my campaign. I've talked about health care a little bit. I guess I would say that one of the things that's gotten a lot of attention on my campaign has been trying to lower co-payments for seniors. And I hear about this every day, so I'll talk a little bit about that in just a second. And then the third issue was education, and I think I kind of answered that about my understanding of the 3 tiers of the
yes.
Milwaukee system, or the Wisconsin system. So I think as far as lowering co-payments, this is very important. A lot of the seniors I'm seeing talk about a donut hole, so this is where they pay into a drug plan at the beginning of the year, a couple $1,000s, and then after that they have to pay for the rest of the year until they get up to like $6,000, and then the insurance kicks in again. And so this then, the donut hole becomes a financial barrier to staying on medications, especially for diabetes, to affording test strips, to check their sugars, and going back to the preventive approach to a health and all policies. I think that you need to be able to make sure that seniors can afford to pay for their medicines, and that's one of the big reasons that seniors aren't compliant with their medication regimes, is that they simply can't afford them. And so I think that would be one of the things I would work for in the legislature, would be to try and close that donut hole. And I don't know exactly how I would do it. I would look for ways to maybe not raise taxes, but take things from other areas that I see as less important to a health and all policies approach, and maybe funnel them into what we call badger care, to try and cover some of these medications, especially for people who are what we call dual eligible, so they're eligible for Medicare and Medicaid. This is, you know, the population that's going to cost, again, Wisconsinites the most money, because they're the 50% who take up 10% of the healthcare costs. And so I think we need to be creative. We need to look at the numbers, look at the bottom line, and try and figure out how it is we can keep these people out of the hospital. And one of the ways you do that is making sure they're compliant with their medications, and they can't be compliant if they can't afford them. And I think that donut hole is one of the areas we can look to try and save Wisconsinites some money.
Okay. And finally, do you want to highlight any differences between you and your 2 opponents in the June 23rd primary?
Well, I would say this. As a physician, I think my campaign is more grassroots driven than either one of theirs. I've gotten all of my signatures from within a 5-block radius of where we're sitting right now in downtown Waukesha. And I think really what I would focus on is some of the healthcare aspects that I don't see the other 2 candidates talking about. And that's what I bring as a physician. I think I bring a healthcare and all policies approach. And I would say the other 2 candidates focus on accounting and public safety, as I understand it. So both of those are important issues. I've met both of them. They're both delightful gentlemen. I think the voters of Waukesha County have a tough choice on June 23rd. And whichever way it goes, I think the best man will win.
Thank you. Mikael Langner, of Waukesha is one of 3 Republican candidates in the June 23rd primary in the 33rd Senate District. Mr. Langner, thanks for taking time. Thank you.